Hi, Matthew Hazel with Myobar Myofascial Tools. We're going to do a comparison of our Healing Edge tools. We have the Healing Edge S and the Healing Edge M. S is for small anatomical targets or small tissue strokes, and the M is for medium-sized. So in the lower extremity, perhaps around the knee, going into the hip, these are medium targets. You want to grab a little bit bigger tool, lets you work more ground, lets you put in a little bit more tissue force into those larger structures. The S tool is perfect around the ankle, the toes, plantar fascia, TMJ, AC joint, wrist, hand, or anywhere you want to do a really focused small stroke. So try to make this intuitive and try to make it really easy when you're treating an area. You think, oh, I'm just looking at the ankle today, I'm going to grab a smaller tool. Or I'm working around the hip, I'm going to grab the medium tool. And that way for one treatment, you just pick one tool, scaled for the size of anatomy that you're working on. In terms of the 1, 2, and 3, the ones are going to be more straightforward. They're going to be really efficient. They're going to have a lot of features. But you're gonna get a little bit more as you move into the 2 and the 3. Okay, but they're all finished to the same high level quality, made from the same good materials. You just get a few more extra features as you move up. But let's talk about the most important feature they all have, and that's this combination head. So in one head, as you hold this tool, without switching your hand off this part, you're gonna get a convexity, you're going to get a prow, you're going to get a hook, and you're going to get a concavity. Okay, and that's going to be in the traditional small radius edge, common to instrument-assisted soft tissue mobilization tools. So it scales. So see, here it is, combination head, there it is a little bigger. Here it is a little bigger. Again and again. In terms of the other side of the tool, that's where we put the large radius edge. And that's a feature of our tools that lets you press deeper into the tissues without causing discomfort. Okay, sometimes these sharp edges, they work so good for superficial areas, but you want to go deeper and the patient says, whoa, it's too much. Or you're in the glutes, so there's adipose tissue, or the skin is sensitive. There's a lot of reasons. You're over a bone. That's when you can switch to these larger radius edges, all right? And you can still do your treatment and then work deeper with less discomfort. Okay, so moving up into the 2s, what you're going to get is you're going to get more of that large radius edge in a symmetrical tool. And the symmetry is nice because you can just flip the tool during a treatment. So if you really like that large radius edge and you're really comfortable with how this works, it's just a simple flip of the tool to go between those 2 sizes. Okay. When you come up into the 3, you're going to get the scallops, and you're going to get these tissue reliefs. And those are demonstrated in the individual tool videos. Okay, but they're going to give you a little bit more penetration in the tissues and a little bit better tracking. And these scallops also help if you mainly use the smaller radius edge. This handle is just slightly more ergonomic and easier to hold. Although I'll tell you, all tools, I guarantee it, with these finger reliefs and finger notches are extremely easy to hold and control in the knife hold and in the pen hold when you work it like a pen. So that's the basics of these 6 tools, okay, scaled for small, medium, but you get the idea of the profiles going up as you work into the Healing Edge 2, Healing Edge 3. Any more questions, don't hesitate to contact me.